lung microbiome. That, as with the general microbiome that we discovered 10 to 12 years ago, we only discovered the lung microbiome 5 years ago. And much this work is done in University of Michigan and out on the East Coast. And what we've learned is that lung microbiome is probably what determines if you're staying healthy or if you get COVID-19, are you going to have complications, including ending up on the ventilator, are you going to survive or not? And I think we're just still scratching away at understanding all that. In ways we're in the solar system trying to get to Omaha, we're going to get to Omaha, yes, eventually we will. But you know, I think the importance, as this relates to halotherapy, we know the normal lung microbiome relates to your oral microbiome, oral pharyngeal microbiome, and whatever's going in the upper respiratory tract is going to, in part, determine your lung microbiome. So if you get sinus infection, if you have underlying chronic respiratory infections in the upper respiratory tract, you end up with bacteria that should not be there, like Haemophilus and Moraxella, Strep pneumoniae, and it goes back to this so-called lung microbiome. There's three determinants as we go through in this lecture series. Is you've got migration of bacteria, and we're all constantly inhaling in bacteria, and we go through those numbers, and we're also constantly microaspirating, especially when we sleep soundly. So you've got immigration or migration, then you've got elimination, all these normal protective mechanisms that clear the microorganisms through the mucociliary apparatus and so on, and trying to prevent things from getting down in those 600 million alveoli, those alveoli that about the diameter of your hair, and that protective mechanism of elimination. And then there's the regional growth factors, and that's where halotherapy comes in, dry cell therapy, because you're affecting those local growth conditions. And if those local growth conditions are thrown off, then you can potentially get pathogens like Pseudomonas can overgrow when you've got certain changes in those regional conditions.